You guys ask me this all the time. Do you have to have your fillers dissolved before facial surgery? The answer is sometimes. So under the eye, if you're getting your lower lids done and you've had previous tear trough filler, how recently? Ever. If you've ever had tear trough filler and you are getting your lower lids done, you need to have your tear trough filler reversed. And I can hear it already, but why do I have to have it reversed if it's been 2 years ago or 5 years ago? It's gone. No, it's not. There is still some tear trough filler left under your eye, even if it was 8, 9, 10 years ago. I know it sounds crazy because filler is only supposed to last for a year, but I promise you it is still there. So you need to have your tear trough filler reversed. If you're having lower eyelid surgery with me, we will dissolve it for you. We will reverse it for you at no additional charge. And I like to do that about 2 weeks before your surgery so that if you bruise and get a little bit of swelling, it's all gone when you come in for your surgery. If you're having it dissolved locally at your local practitioner's office, you need to be careful because a lot of local practitioners, if you say, I need my filler dissolved, they'll say, well, it's been 2 or 5 years ago. There's nothing left there anyway. There is, and so you had to convince them to do it. The second thing is the dissolving material, hyaluronidase, the enzyme, is expensive. A vial costs several $100s. And so if you're going into your local place asking to have your filler reversed, they're probably not going to use a whole lot of it because it's expensive. So you need to tell them, I need it all reversed, totally, completely reversed, and I'm willing to pay the cost to get it reversed. And you say, willing to pay, those are magic words. Make sure they use enough to really get the filler reversed. So why do I care? Why do I need it reversed before eyelid surgery? Because I'm going to be removing fat from the fat bags, but where your tear trough filler is, that's an empty spot, and I will need to place fat into there, and I need to put just the perfect amount in. And I'm guessing that perfect amount, or it's not even guessing, I'm assessing that perfect amount and judging it by how it looks when I'm placing the fat. So if there's any filler still left there, it can look perfect at the end of surgery. And then 6 months, 1 year, 2 years later, as that filler continues to dissolve away, suddenly it looks like I didn't place enough fat. So if you've had under eye filler, tear trough filler, ever, it needs to be dissolved at least 2 weeks before your lower lid surgery, and it needs to be dissolved well. The other place where filler needs to be dissolved, if you've ever had it when you're having surgery, is the nose. If you've had a non-surgical rhinoplasty, ever, and you're then converting to a surgical rhinoplasty, it similarly needs to be dissolved completely and thoroughly at least a few weeks ahead of time. When you come in for your rhinoplasty, we are doing our surgery based on how everything looks. And if there's filler hiding bumps originally, when that filler goes away after the rhinoplasty, you're going to be sad with your final result. Similarly, when you have the filler reversed, it could create a little bit of swelling. We need that to come and go at least a couple weeks before your rhinoplasty surgery. If you've had cheek fillers or jawline fillers and we're going to do a facelift, honestly, it doesn't make that much difference. If it's overly done and it looks bad, I would reverse it for that reason. But if it's tasteful, I don't need you to reverse cheek or jawline filler or nasolabial or marionette or lip filler, really ever, before any kind of surgery. Tear trough, nose filler, those are the ones that need to go. I hope that was helpful. Thanks.